Next set of cases is by Dr. Vatsal Parekh. He's showing certain diabetic cases, and
let me first admit that I don't know the answer, so I'm showing. Okay. Now, so this is for you also. You'll have to help me to get the answer. Okay. Now, this lady, I'm just showing the 3 patients with unusual outcome following surgery. This lady had vitreous hemorrhage. This is photograph of 3rd December 2014. Paritosh, next. Now this is the FFA, which shows disc leak and leakage from the new vessels elsewhere, probably like any proliferative diabetic retinopathy with lot of peripheral non-perfusion. Next. The hemorrhage clears, and if you see on 5th January, this photographs, see this area, where is the pointer here? Now this area there is no proliferation. Next. Now she develops again another bleed, and this is in August. You see there is a proliferation here. So you feel that the vitreous hemorrhage is a source of proliferation, and that's why she has developed proliferation along the arcade superiorly. And these are the post-op photograph following vitrectomy, where you see a subretinal blood here, and there was a scar, and there is a linear strand from the disc going down. I'll just show you the video. Now this is following clearing vitreous hemorrhage. There is a proliferation here. I am trying to pull it from the disc, but it's not getting pulled, and in the past I had similar experience in 2 cases, so I just left it and trimmed this area. Now it appeared on table as if there is something coming from behind the disc and you could not remove it, and there was a bleeding here. And patient's hemorrhage cleared probably after 3-4 months. And just go back on the slide, ne Paritosh? Go back on slide. And this is what I noticed. Now other 2 patients what I am showing also had on similar situation. Next. Video pachi ja. Next. Now this is another patient who has a florid proliferation from the disc here, probably. Next. Now see this surgery, here I was able to lift it out. I don't know, but here it was, I was able to lift out, and patient had a lot of vitreous hemorrhage. Post-op took about 7 months to clear. Now unfortunately this was the first patient I operated. I couldn't record the surgery. This lady had this type of proliferation from the disc, very florid, angry looking. And on table after doing vitrectomy, I tried to peel it from the disc. Now it could not be peeled, and at the table, on the table, I felt that I was pulling something on the retina, and I just stopped. And post-operatively, she developed a scar here, and there was a scar here. So probably the first and third patients have developed scar here, and this was the first patient where I pulled excessively, and I probably damaged the nerve fiber and caused a scar here. So. And this patient also, as I showed you the previous angiograms, I think there are angiograms. Okay. The second one is not diabetic, but the first and third were diabetic. And you know, on table you felt, normally in diabetic vitrectomies you peel, or else this is you peel, you are able to lift it from the disc. These 2 patients I felt as if something was coming from behind, whether it was persistent posterior hyaloid, but I couldn't see pre-op, that's why I showed angiogram. So I don't know. And the third patient which I operated, I was little wise, so I didn't traumatize more, and I just left it there. So I have not understood what could be the cause or what could be the anatomy. Unfortunately, this patient's video is not there, otherwise it would have been a great help.
The first case, he developed a subretinal bleed, right?
Yeah,
on the table.
On table. Means when you are pulling, you realize that it's not coming, Your forceps is good. It's not that the forceps is not good. And you could see that there's pull and there was bleeding on the table.
Your forceps is too good. That is why you pulled. You pulled not only the tissue, but you could pull the retina and
No. But this is over the disc I'm pulling.
So that's what I'm saying. I'm saying there's nothing wrong with the forceps. But basically, the bleed is not pre-retinal. It is occurred subretinally.
Right.
So obviously it means there is something which is facing the undersurface of retina which bled subretinally. So whether it is sometimes this happens when there's a chorioretinal scar. For example, the first case where I had a problem maybe 25 years back, I can now forget that case because it was a case of Toxocara, which had a lot of fibrosis, and when I did the surgery, it was so nice. I could remove all the pre-retinal tissue. The retina was nicely attached, macula looked good, and it went through the retina at one point. But I was naive and young, so I did not realize that it's actually going through the retina and having a chorioretinal scar. I thought it is still pre-retinal, and I pulled on it. When I pulled on it, it bled subretinally. It was a huge, massive bleed. And those days we didn't have TPA, and even if I had TPA, of course, such a huge clot, you wouldn't have done much. You would have had to cut a thesis degree retinotomy and all that. I did not do all that, but I lost the eye ultimately.
But sir, I can show you the video because that point is clearly shown. It's over the optic disc. I can play the video again.
No, I agree. I'm not trying to compare the
I'm
two
just
cases.
saying that this particular...
Because the last case which you showed shows
Yeah.
a subretinal scar.
But there also I pulled on the optic disc only. And the
I
last...
agree. But if suppose there was a subretinal gliosis, which is also extending towards disc area,
Unfortunately, no, because that patient was coming to me 2 years prior and
you could see
it
that
was fine.
it
So
was
6,
fine.
6 and 6. So I don't know. No, I just showed 3 cases to diabetic where, like any regular diabetic patient, you pill from the optic disc, and this patient had a blood vessel like thing which could not be pilled, and both patients developed a scar at the infronasal region. And the first patient which I did, I was not experienced, I was little hard in pulling. So there is a scar. This is the video. So that he developed a scar in papillomacular bundle. So I had